Hi, my name is Tristan Smolarczyk, and during my SP, I had to spine board a patient. Well, there was several things I feel like went really right, and several things I feel like didn't go right at all. I know that for a fact I had called 911. I was able to introduce myself. I asked about numbness and tingling. I asked the patient if they had ever been in a situation like that before, and I just overall felt like I made the patient more comfortable. I kept communicating with the patient, talking to her, making sure she was okay with everything that was going on. I told her what happened with each thing, what we were looking for. I just wanted to make sure I covered most of my bases with my patient, which I feel like was a pretty good start. There's some things I know I missed in between because I was busy trying to continue my communication with the patient. I know I did not keep the head stabilized as well as I should have during the roll, the log roll. I felt like it was kind of a little bit wobbly and shouldn't feel like that. I didn't really check for facial movements. One of the things that you're supposed to do during the neurological testing is test for like monkey face, tongue out, the basic stuff like that. I forgot to do that, and I know that I didn't check for grip strength. And an important thing I realized while I was watching the video that I could have done was I could have utilized the crowd, because I know my patient didn't really remember much of what happened, so I could have utilized the crowd by asking them what had happened, if they heard any like popping, cracking, anything like that. Could have asked them questions about like if they were experienced in spine boarding or anything like that. And so basically I know that for my future encounters I can take what I know I didn't do and add on to the things I did do to make it almost a perfect scenario. I could utilize the crowd, I could ask more in-depth history questions, and I could also, one thing I realized when I was watching the spine boarding video to make the head more stabilized, I could have used the C-collar, put that on before spine boarding to keep it more steady. And then I could have just been a little bit slower going through the neurological testing because EMS wasn't showing up just yet, so I could have taken my time going through everything, making sure it was all cleared. But overall, I felt like I did pretty well on my SP. I felt more confident than I did on my last one. And I still know I have a long way to go with my confidence, as well as projecting my voice while speaking with my patients. But I felt like I made my patient more comfortable, and I did things a little bit more smoothly than last time.